In this What We Are Reading, we are going to talk about a book by Kresser, who is a licensed acupuncturist and also functional medicine practitioner, and he had his book Unconventional Medicine. I wasn't entirely sure what to take out of this one going in, but ultimately this one is about looking at medicine in a different way, not necessarily treating anything or making any real recommendations. There's a lot of other books out there for that, but this one was really just highlighting the difference in a lot of things within the medical landscape. And so we were just going to kind of talk about it, what we took away, how it might apply, what you would potentially want to look at if you wanted to check this book out or look at functional medicine in and of itself. So there is no question that the medical landscape is complex at best, absolutely a mess at worst. I've personally haven't done a lot in the traditional medical sphere for my own care. Definitely one of those people that have gone, I'll say today's Wednesday, a decade without actually really talking to a doctor or getting a checkup. And so I haven't necessarily utilized it as best as I could in that regard. And obviously there's things that come along with that, insurance and whatnot. But now having worked in it a little bit more in a sports medicine clinic and just seeing the difficulties that we deal with and some of the things that we do in orthopedics, I can only imagine how much more complex that gets as you're looking at family medicine and just general practitioner care for looking at that. That's one of the things that this book talked about when it comes to unconventional medicine is what is the true definition of healthcare versus sick care. That's something that's come out a lot, is the traditional medical model really about healthcare. Like, yeah, you do your annual physicals and there's some recommendations and you should do this, but are the resources always there to get backed up in order to accomplish those things versus getting another pill or another test or something along those lines that may be exactly what you need? And there's definitely a time and place for that, but really those extra resources aren't necessarily followed up by reimbursement, and healthcare is a business model, and unfortunately it is that way, especially if you're in the U.S. So really they did talk about that. They didn't throw out the traditional healthcare system in this book, but there is a time and place for all aspects. But what do you do if your conventional medicine isn't working, if you're taking a medication which results in some side effects that ultimately lead to another medication, and this kind of vicious, hopefully ending, but maybe never ending cycle? And really that is what they talked about, is where traditional medicine is really good in emergency situations, or really looking at something that has gotten to the point where it's really bad. It's great and can be life-saving. And for some of the things that, there's different opinions on this, but cancers, things along those lines, some of what has been obviously found in traditional medicine is hugely important for those things, and has its time and place. Surgery to remove things or repair things all have their time and place. But really what they were looking at in terms of the unconventional or functional medicine is really taking a comprehensive view at the whole organism, not just one individual organ or one particular symptom or one system. Could something somewhere be seemingly impacting everything else, and we're just overlooking that? And so really it is focused on going in deep and figuring out what those might be, and then trying to address that in different ways, which may include medication ultimately, but there are different diet options, potentially some supplementation or other things that could go and take a look at. But they also are not slow to say, this takes commitment from both sides, both from your practitioner but also from the patient, in that you have to be bought into this process or else it won't work, because there isn't necessarily a quick fix in functional medicine, but there are other options that you can go and take a look at. So that is something to keep in mind there. And really, again, it's coming back to addressing the underlying issue and not just the symptoms. So we're not trying to play whack-a-mole with different symptoms that then just start compounding. It's really trying to get to the root of it all. So ultimately, what do we take away from this book? Well, there can be a really good complement to these two systems. There's, like I said, a time and a place for both, but for the person, and again, this with functional medicine, insurance, touch and go, depending on where you're at and what your insurance is, may not have anything to do with it, and that makes it hard for people, especially if you do have health insurance and are paying premiums for it. A lot of these practitioners are cash-based, but that might be worth looking into to see if that's something that could help complement if something just doesn't seem to be going right, or that prescription you got isn't fully addressing your issue, and you want to take a look at lifestyle factors or other things that could potentially have accumulated over time. So that could be a good way to address. So we'd recommend, if that's something that interests you, taking a look at functional medicine practitioners in your area. In terms of some diet and lifestyle things, that's what we're hoping to help provide some of the basics from what we can with Clinically Pressed to give you a starting point and maybe help guide you in a direction to a practitioner that could help you take that next step and really get feeling good. So ultimately, Unconventional Medicine by Kresser. If you're a practitioner, it's an interesting read, kind of gives you a different view of everything. If you're a patient, could also be interesting, maybe not quite as interesting. Again, it doesn't necessarily address any specific things that are going on that you might want to check out, but still an interesting read. Kresser puts out a lot of good information that you can check out. There's a lot of also good things out there. He references Dr. Terry Walls and her protocols that she utilized to help fight MS. Really good stuff out there to further check out. So we will link the book on our link tree in the bio, or also in the show notes if you're looking at the page, and it'll be on our social media. But what we were reading, Unconventional Medicine, just a different look at the healthcare system and what you could do to help better your health. We'll be back with more research reviews and other information with you next week. Hope everybody's enjoying the end of the year and having a good holiday season.